Hip pain and back pain in women, turns out it's different from hip pain and back pain in men. The causes are totally different for a woman with chronic back pain and hip pain or hip pain than a man. In a woman, because her pelvis is larger and because often a woman has been through one or more pregnancies, that presents a certain kind of trauma to the pelvis which men simply don't have. When it happens in a woman, what happens is some of the ligaments of the pelvic girdle are stretched out. And those ligaments are what hold us together and make us stable. They hold our sacroiliac joints together, sometimes known as hip joints, and they hold our pubic symphysis together. And together that holds the pelvic ring together. If that pelvic ring becomes unstable and starts to wobble, as it sometimes does following pregnancy or following injury in women, then the woman might get hip pain, they might get bursitis, they might get buttock pain, they might get low back pain, and they'll go to a lot of different healthcare practitioners, each one looking at it from their perspective. If they go to a spinal surgeon, their discs will be looked at. If they go to a therapist, they'll find their sacroiliac joint is out of place, or similarly with a chiropractor, they might get shots of cortisone in their greater trochanteric bursa. They might get trigger point injections. They might get dry needling. What's missing, though, is nobody's looking deeper at the problem, at the actual cause of the problem. The cause is that the pelvis itself is unstable and it's moving, and that's what allows the sacroiliac joints to slip out of position and create all these problems is loose ligaments. And if you can go in and tighten up the ligaments, which now we can do, you can cure these people. The ligaments can be tightened through the injection of a growth stimulant, which comes from your body. It's called a biologic stimulant, and we derive it from platelets. We take the blood out of your body, out of the circulation. It's just like a blood draw. We take it up to our lab and we extract the platelets and concentrate them, and when we inject them into the ligaments that hold the pelvis together, the sacroiliac ligaments, the pubic symphysis ligaments, we're able to take those ligaments and shorten them, tighten them, and make them stronger. And that holds the pelvis together and makes it a strong unit. Well, once you make that pelvis tight and strong, all the muscle injuries and the muscle pain and the tendinopathies and the bursitis, that all goes away. And the person is able to regain their sport, they're able to gain their life, they're able to start doing carpools again with their children and get their life back. This is such an overwhelming problem in women because nobody understands that back pain and hip pain in women has a different cause usually. So we're very successful, and we've had helped so many women with this condition. Unfortunately, it's not diagnosed as often as it should be, and there aren't a lot of doctors who have the tools to actually fix it. I've been gratified by the results since we started doing these treatments, because it points out that these conditions are far more prevalent than we once thought, and it also points out that patients' lives are very severely impacted by these conditions. The people that I see as patients, the women that I see as patients, come with a very long history of incapacity and not being able to do what they feel is important in their life, be it taking care of their children, doing their sport. They're in chronic pain and they're not functioning very well. And it's been, as I say, gratifying to be able to treat these people with this wonderful treatment called platelet-rich plasma and actually get them cured.